Hi, this is Menace Joandes, Chief Medical Director at Optimum Re, and this is the Optimum Academy Alcohol Markers 101, video number 4, ethyl glucuronide and ethyl sulfate. So let's get started here. An underwriter's arsenal for evaluating ethanol use. We're all aware of these. Any history of alcohol criticisms and APS or any MVR infractions would be important to know when evaluating someone's risk for ethanol use. We look at the LFT findings, the liver function tests, AST-ALT ratio, see if there's any elevation of that. We look for a high MCV on the CBC due to alcohol's influence on folate metabolism. It has a macrocytic influence on the size of the red blood cells. And then we look to see if there's a high HDL, that's the good cholesterol, which we like to have high levels of good cholesterol, but not necessarily due to high levels of alcohol intake. And the mechanism for that is not well understood. So these are the tools that we use commonly. We also have used carbohydrate deficient transferrin, or CDT. And CDT actually, there's levels of CDT, and the labs use levels greater than 1.5 to 2% as positive levels. And this is a possible proxy for heavy alcohol use as well, but it doesn't function as well to indicate occasional binge drinking. It's more for consistent heavy alcohol use. There are false positives when used as a screening test in generally healthy life insurance applicants. And my bias, I've never been a big fan. I never wanted to use positive test results when I was questioning whether they were actually accurate in people that had no apparent excess alcohol intake. Now, we've talked in prior videos on alcohol markers about PEth and the PEth levels, and the main PEth level we use is called POPE, PEth, and it's the signature and numerically is PEth 16:0/18:1. That's the main marker that we follow, and less than 20 nanograms per milliliter indicates the person is not drinking ethanol. And we've talked at length about this before. And that's the main, what we call homolog, because actually PEth has 48 different homologs, but the PEth 16:0/18:1 is the main one and accounts for about 37 to 46% of PEth. So that's the one we basically follow. It's stable for up to 28 days, so the discovery window is up to a month. Women have higher levels of PEth after drinking equal amounts of alcohol as men because they have fewer red blood cells. We talked about that in the prior videos. And CDT can be negative with a positive PEth, since PEth is a very useful quantitative indicator of how much alcohol the person has ingested. But there are also urine ethanol markers, and that's what we want to talk about in this video. And there are two of them. The first one is called ethyl glucuronide, abbreviated ETG. It has a detection window for up to 80 hours after ethanol ingestion. Some sources say it can be found up to 100 hours after ethanol ingestion, but I'm using 80 hours here as the average basis. However, this can be false positive or false negative, and it can be affected in both a positive or a negative way by bacteria in the urine. So that's one of the downside features of ETG. However, it's also used in conjunction with ethyl sulfate, ETS, and if both are positive, that's a better indicator. The detection window for ETS is up to 24 plus hours after ethanol ingestion, and it's basically a confirmatory test for ETG. So if only the ETG was positive, that would be less reliable, but if both are positive, that's a better indicator that the person being tested has had ethanol ingestion. Both serve as biomarkers for recent ethanol consumption, but not as a test for intoxication. As I said, dual ETG and ETS positivity increases the reliability, and proper specimen handling, pre-analytic storage is key, so that we limit the likelihood that bacteria could affect the ETG levels. Just to remind you about alcohol content in commonly used household items or drugs that are provided or prescribed for patients, especially Listerine, which has a very high alcohol content at 26.9%. Soft soap hand sanitizers, the gel is at 60 to 65% alcohol. And you can see that if any of these substances were to contaminate the specimens, they would increase the alcohol content. So those are always things to keep in mind when testing for alcohol markers. This is the publicly available Quest Diagnostics information on ETG and ETS, and I just put it in here for completeness so you can read about additional information on both of these tests when they are ordered through Quest. And you may never have seen it or been aware that these tests were ordered by a physician and they were in the APS. You may have scanned over it and not recognized what ETG or ETS were. So here's a copy of a Quest report, which I found in an APS. And you can note in yellow, I have highlighted the ETG and ETS to the left. I've highlighted in red the levels, which are very high levels. So these are positive tests in this particular instance. And in green, I've noted what the normal levels would be, less than 500 for ETG and less than 100 for ETS. So this person obviously had high ethanol intake, and in the detection window was found to have a positive test for both ETG and ETS. So what are the uses for these alcohol markers? As for PEth, which we talked about before, so it can help us with underwriting ethanol risk. In many cases, when we have a questionable history or we're not sure exactly how much alcohol the person is drinking at the current time, these tests can be very useful. Claims that are cases that I see often, I would definitely be able to utilize these to help me assess the risk and stratify whether somebody is in a better class or not. It would certainly help in certain life insurance claims, fetal alcohol spectrum disorder to see if the mother was drinking alcohol before the baby was born, monitoring abstinence and addiction treatment programs. Clinical applications would be before patients are approved for liver transplants, make sure they're not drinking alcohol, which obviously would be a negative factor. It can be used in forensic applications, post-mortem analysis, can be helped to determine alcoholic ketoacidosis, can be used in workplace testing, as well as driver's license re-granting when people have possibly had DUIs in the past. So our takeaways are, as we talked about in the sum total of the videos we've had on alcohol markers, PEth offers new hope for a better risk assessment of ethanol use, but also useful for ethanol ingestion in the last 24 to 80 hours, our ETG and ETS. And you can send us any questions to our email address at info.us@optimumre.com, and check out my webinars on cholesterol and lipoprotein in addition to the alcohol markers, which is on optimumre.com Knowledge Center. And check out our Optimum Academy videos at the optimumre.com website.